Kia ora koutou katoa. Welcome to the Ministry of Health and to today's update. And you'll notice there's no sign language interpreter today, but the stand-up has been captioned in real time on our live stream on the Ministry of Health website. Again, today there are no new cases of COVID-19 to report, so our number of active cases remains at 22, and all of those cases have recently returned from overseas and are or were in managed isolation. There is one person who remains in hospital stable on a ward. That is in Auckland City Hospital. And just to reiterate, no cases of community transmission. So our total of confirmed cases of COVID-19 remains at 1,178, the number we will continue to report to the World Health Organization. Yesterday our labs completed 4,530 tests, and we have now surpassed over 400,000 tests, with 402,000 tests having been processed since we started testing for COVID-19 back at the beginning of February. And just to put those case numbers in context, you will have heard overnight the Anthony Fauci from the USA talking about the possibility of 100,000 new cases per day in the USA. That would be the equivalent in New Zealand of around 1,500 new cases per day, which is more than the total number of cases we have had since the start of this pandemic. So worldwide, the number of cases continues to increase, and we're seeing, of course, resurgences in some countries where controls, including lockdown controls, have been relaxed. And obviously yesterday's developments in Victoria and Australia, particularly in those suburbs in Melbourne, where they have reimposed some conditions around people's movements, are a reminder that community transmission in the future is a real possibility, and we may here need to take measures to, local measures to counteract community transmission if it occurs again. We will be watching carefully and continue to work on a daily basis with our Australian colleagues to see what's happening there. So a key takeout for us all, and you'll hear me say this more than once today, is we need to just remain vigilant. Things feel very much back to normal here in New Zealand. We are almost unique in the world in that respect. However, we do not want to give up our hard-won efforts and the opportunities afforded by being in Alert Level 1 and our ability to have our domestic economy and how we can live our daily lives compromised at all. So I just want to reinforce those key public health measures. They remain fundamental to our success now and in future. Most importantly, if you are sick or your child is sick, please stay at home or keep your child home. Do not go to work and don't go out visiting or socialising. If you have symptoms of cold or flu-like illness, ring your doctor or healthline to get advice about getting a test. I'll come back to that. Good hand hygiene remains a simple and effective tool, not just for preventing COVID-19, but many other communicable diseases, respiratory and beyond. Please keep track of where you have been. The easiest way to do that is to have downloaded the COVID Tracer app and use it. Many premises now have the QR code, which you can quite easily scan. And please make sure your contact details with your GP or on the app are up to date. And as I've said before, even having the app and having registered means we have your up-to-date contact details, which, should we need to call you, make it much easier to do so and increase our likelihood of doing so quickly. Just one other point I'd like to make before I go on to an update on some managed isolation contacts. I've talked right since the start of the outbreak about showing compassion for people who may have COVID-19. It is relatively rare in this country. We are fortunate in that regard. There is no stigma associated with having the infection. We have seen it can affect people from all walks of life across all demographic and ethnic groups. I met with Air New Zealand's Chief Executive, Greg Foran, yesterday, and he commented to me that some of his staff and crew members, particularly those flying international routes, have been facing some hostility and suspicion in their local communities. Again, this could be your friend or a family member. Please do show tolerance and support them. Remember that it is in their very best interests to make sure they are keeping themselves and their families and their communities safe. They do not want to create COVID-19 infections in New Zealand, and I know they are working very hard and focused on ensuring that doesn't happen. An update on the people who left managed isolation between the 9th and 16th. Reminder that first of all, we had already some time ago followed up the 55 people who had not completed 14 days for a range of reasons, mostly compassionate reasons. So we have closed off those people. All other people had been in managed isolation for a 2-week period, and it has now been more than 2 weeks since the last of those people left. Around 60% of those people have not only been contacted, they have had a test either before they left, that was 800 of them, of the 2159, the balance have had a test since, and there are 366 people who have been further contacted who have also been asked to get a test, and we expect more testing to come in. There is also a group of around about the same number, actually 367 as of yesterday, whom we have made contact with on a number of occasions, including leaving phone messages and or texting, but who have yet to respond. And I've asked the team just to have a look at why that might be. It may be there are language difficulties, and we want to make sure that we're finding out why there is this group that isn't making contact. Let me be clear. It's at this point in time, they present a very, very low risk to the community, recalling that they had all completed the 14 days of managed isolation, which has been fundamental to our response since the 9th of April. So for those people who may have been contacted and haven't yet spoken with Healthline, please do so on the number, which is 09302 0408. And finally, on the NZ COVID Tracer app, just to reiterate the point I made earlier on, please continue to encourage people to download the app. The success of our response, if we get community transmission, and you will have heard from Victoria that even with a number of cases, I think they had around 75 yesterday, their resources are stretched. One of the things that makes the job of contact tracing easier and successful is if we have people's up-to-date contact details, and this is one of the key values of the NZ COVID Tracer app. So please do download that. Businesses, if you could put up your QR posters if you haven't already, and register, then that will mean we are good to go and in the habit of using that technology to assist our contact tracing efforts. I can assure you that the Ministry of Health remains working incredibly hard on all aspects of the response to make sure we are ready, not just to prevent cases coming in, but should we get a case of community transmission for whatever reason, or a community case, that we can respond really quickly and stop any further transmission. We must all continue to be vigilant and play our part. We certainly are, and I'd encourage all New Zealanders to continue to do so. We have got this far by acting together. We will continue to do well if we continue to act together. I'm open to questions.
From a health perspective, what would your response be to concerns about people reportedly sharing rooms or sharing bathrooms in the managed isolation? From a health perspective, why is that a problem?
If people are in the same family group or sort of small bubble within managed isolation, that's fine. The reason in managed isolation we like each person or small family group to have their own bathroom is again just part of our managing the risk down to the lowest possible level. The reason we want to do that is, of course, the 14 days is the gold standard. If people have come in and may have been infected or brewing the infection, they've time to have got over it, and of course with the testing we are very likely to have detected it. But we don't want cross-infection within those facilities, hence the physical distancing requirements and these very strict requirements around not shared bathrooms.
So we've had reports in that people are being forced to share communal bathrooms with strangers. That is pretty concerning Do you?
It would surprise me because of the nature of the accommodation. They will have each hotel room will have its own ensuite facility. So I'd be very interested to know. The question may be if there has been people using some of the public toilets as well. That would surprise me because people are in their own hotel suites with en suites.
Is there ever a situation? Sorry, just to follow up one more thing. Is there ever a situation where someone would have to share with a stranger? Like if there was, say, a double room with 2 beds, would that ever be a requirement as part of the managed isolation?
Is this an in theory question, or is this something?
Someone said that they're doing that, and my understanding was that it wasn't happening.
Yeah, I would be very surprised. I'll check with our all of government team that's that Air Commodore Webb is leading, just to check that. It would surprise me greatly if that was the case, because this has been one of our strict criteria, and in fact one of the reasons why we felt we couldn't approve the proposal that was being put forward by the universities to bring students in was because the accommodation arrangements included shared bathrooms. That was almost the main sticking point. So this is one of the areas we're very strict about.
How are we managing our quarantine differently from Melbourne, which mean we won't get transmission from hotel staff?
Well, I've seen some articles written about the Melbourne situation. I think 2 hotels where they've had people working there, and I think at least in one it was possibly security staff there who were externally contracted security staff. We've got really clear protocols, and the staffing of our facilities is done by people who are working already in the public service, the wider public service, and in particular you've seen that big increase in the use of Defence Force personnel for security in some of those roles as well. So it's not straightforward running these facilities, and that's why we did the review last week. We found some things that could be improved, and we want to continuously do that to improve.
What measures are in place in our facilities that will protect Kiwis in there from getting transmission from staff?
From staff or transmitting to staff?
From staff.
Well, I think what happened in Melbourne was that one of the security staff was infected by someone in a facility, and that's how it got out to the community. Again, the protocols are very clear, designed to stop guests infecting each other and also guests infecting staff members. So there is a whole range of measures in place. For example, symptom checks on staff at the start of each day. We've tightened up or expanded the use of masks in the guests coming in and for staff who are working there. But just a reminder too that these protocols have been in place and working effectively since the 9th of April, where we have seen no cases come out of those facilities into the community, either people who have been in managed isolation or staff who have worked there. And as part of our surveillance testing through alert level 3 and into 2, we did quite wide testing of airport staff and staff working at the facilities and didn't find anyone who had evidence of infection.
Jetstar have resumed 60% of their domestic flights from today. Do you plan on, or have you had any conversations with Jetstar yet? About
domestic flights? Not specifically, but they will be aware of the protocols that are in place for domestic flights. I understand that Air New Zealand has moved to making masks available for people on domestic flights should they choose to use them. That's fine. There's no requirement to do that, remembering that one of the things is we're in alert level 1, that's why we're in this room together. We don't need social or physical distancing, we don't need to be wearing masks. So no specific expectations or requirements on Jetstar for domestic flights.
Would you encourage Jetstar to provide facial masks?
I think that would be up to them to do. There's no particular requirement, and again, face masks in alert level 1, we're not expecting or requiring, may well play a role as part of our avoiding going up alert levels in the future. If we feel we have evidence of community transmission, there could be a role to play there.
And those flowers you were gifted, who did you receive those from?
I don't know, they were anonymous.
And where have you placed them? Are they in your office?
They're on the desk by my PA's, where my PA sits. She certainly deserves them.
What kind of flowers were they?
I'm not sure, I'm not an expert on flowers, I'm sorry. Please.
You mentioned the importance of the NZ COVID Tracer app. The documents released on Friday indicated the first version of the app, which would have just allowed that content information upload, should have been launched on April 20 instead of May 20 when it eventually did come out. What was behind that delay?
So two things there. First of all, we wanted to see if we could launch it with some other functionality so that there was a sense that it was creating more value than just simply registering. And the second was, of course, in April 20, we didn't feel it was quite as necessary, and because we were going into alert level 3, we were planning to be there for some weeks, so it wasn't essential that we had it there. So the main reason was ensuring we could have some other functionalities, both when it was released and coming on board again soon thereafter.
And the app eventually came out about a week into level 2, and during that week where businesses were able to reopen but had that contact tracing requirement, we saw a lot of third-party apps like Ripple and so on cropping up. Do you think that 1 week delay there led to lower uptake of the government app because people were confused by all the options, or just didn't think it was necessary?
Yeah, it may well have. However, I think we've given I give a pretty regular plug since, and one of the things we did do early was to enable the developers of those other apps to use the QR code that is the one that we use on the COVID Tracer app, so they don't have to have a separate QR code, and I think that will help a lot if there's just one QR code. I've had family members and friends who say, I've got the app, but the code didn't work for me, and there is a very specific code that works on the app. Ideally, we can move to all the apps using just that single QR code.
You mentioned at the start there now, you're talking about other local measures that we might have to look at given what's happening in Melbourne. Can you maybe expand on what you're looking at?
So I guess what I'm talking about here is, as part of our planning, in fact we raised this very early on, was that there could be measures just in a locality or a town or a city, or as we've seen in Melbourne in certain suburbs, to help manage local outbreaks rather than requiring blanket measures right across the country or even across a region. So as part of our planning for what we're calling an increase of infections, we are looking at what specific measures you could put in place. And so I'm very interested to look and see what is happening in Melbourne and what the impact will be of trying to put those restrictions around movement in certain suburbs.
And could we say face masks? I mean, would you recommend that might be something we might start to do in the future?
Yeah, I think the important thing is to consider all the options exactly. And if you had a localised outbreak, yes, you might provide and require masks to be used in that locality. The value being, the key value there being, I think, in Melbourne is restricting people's movement. So that's the key intervention that will stop the infection spreading.
Yourself and the ministry have the numbers of registrations of the COVID-NZ app. Do you have the numbers of Kiwis actively using it and signing into places across the country?
Yeah, we do give the number every day of the number of times it's been used. So we'll update that in our media release today. I haven't got that number here with me, but we'll update in the media release the total number of apps, the total number of businesses who have registered and put up the QR code, and the number of uses, and compare that with yesterday.
With those flight attendants you gave us that information that not to sort of worry too much about them, can you explain to the public why they shouldn't be nervous? Because you can sort of understand if they were dropping a kid off at daycare or you bumped into them in the supermarket, people might feel nervous that they'd been exposed.
Yeah, I understand why people might feel nervous. I'm just reminding everybody, first of all, even if they are nervous, being hostile or exclusionary to people is of no benefit. The second thing is just reminding people that the Air New Zealand staff are using the protocols that they developed and are internationally tested, and they developed for that very first flight out of Wuhan. And they were volunteers, the crew that did that, in the sense that they put their hand up to do that very first flight. So they continue to take all the measures to protect themselves and then, of course, their families and their communities. And I just want to reassure people that we are working daily, really, with Air New Zealand about looking at any additional things that could be done. And they are obviously keenly interested in protecting their crew and their families and communities as much as we are in protecting the wider public. And just reminding people that Air New Zealand staff see themselves very much as part of that effort.
In terms of reflection, we're now 6 months on from when the WHO first got that report about that first cluster of a pneumonia-like illness. 6 months on, can you reflect, is it too early for you to look back and reflect on how much has changed in New Zealand and the world? Have you had time to pause over the last few weeks and months to do that?
Well, I haven't had much time to pause, I might say, but I am being invited to sort of reflect on some aspects of the response to date and really what's changed over that time. And maybe we could. I am planning to have a bit of holiday next week, if that's all right. But when we come back, we could maybe do a little bit of a reflection on some of the key events that have happened over that time. But just to reiterate, it's clear that, and as Director General Tedros from the WHO said just a couple of days ago, we're by no means near the end of the beginning of this thing. It's a long way still to go. We will keep doing well if we keep learning and adapting and acting collectively, and that's the thing that really sticks in my mind. We've had to be flexible and adapt and address issues and challenges and problems as they've arisen, and that has been key to our success.
What's going to happen with these 367 people you're trying to make contact with? Are you just going to keep standing here and calling them out every day, or are they just going to disappear and that will be the end of them? I mean,
Yeah, what I'd like to do is close that off this week, so that I think the final task for my team is to say, again, this is a learning exercise here. All these people were 14 days in managed isolation. It's now more than 14 days. We've done very wide testing across the community, a couple of record days of testing at the end of last week. We haven't seen any evidence of community infection. So the key learning here will now be what have been the barriers to getting to those people, and it may reflect the people coming back may not have been in New Zealand for some time. There may be language barriers. Many of them, I think, don't have, when they arrive and go into managed isolation, they don't have a New Zealand SIM card. They get that subsequently. We need a process to make sure we can contact them. So I think we'd like to, we'll close that off during this week. But what I can say is we have closed off the 55 who are the ones who hadn't done the 14 days. Of the 60% of the others who have been tested, they were all negative. And I think the balance, it's quite clear, present a very low risk to the community because they had completed that 14 days. Any final questions?
367 is about a sixth of the total number of people. How does that line up with the number of people who didn't respond to contact tracers prior to the past few weeks in terms of over the course of the pandemic? Has there been lots of non-response like this, or is this atypical?
There is always, and I think that the metric is 80% within 2 days, and to go higher than that does require a lot of effort. And this is where the app may be useful, just to get even each percentage above 80% is helpful. But there is a group of people who it just is very, very hard to get hold of, and even if you manage to contact them or leave a message, they don't necessarily respond. And I think that's key. Key thing I want people to take away today is, contact tracing it requires two parties. We can contact, but people need to either ring back or do what is asked of them.
So that 80% figure, just to clarify, it doesn't count people who don't call back. It only counts people who do call back or are able to.
It counts everybody, so that's 80% of the total potential close contacts. Remember, right. The people that we were contacting here were not even contacts of a case. We were just following them up to see, first of all, how many we could get and how many we could get a test on. All the there's a different process for following up the close contacts of the cases there have been in managed isolation over the last couple of weeks, and we can give an update on what the progress with that as well. Recalling that virtually all of those people will be in managed isolation from either the flight or in the hotels. Okay, thank you very much.
Thank you.